Many people are overwhelmed with side effects from pharmaceutical medicine. They are looking for alternative treatments for their condition. Earlier this week, I sat down with the head doctor and office manager Will at Alternative Health, who believe in more natural options as they are making their way to the capital city. Can you tell us a little bit about Alternative Health?
Absolutely. So we started in Grand Forks in October 2021. Sorry. And basically we help people who are looking for alternative treatments for their ailments. A lot of patients come to us when they've been let down by Western medicine and they like different options to pharmaceuticals and they're having trouble finding them. Another thing that we offer is we review people's medical records if they would qualify for certifying for medical marijuana. And that's something that's pretty rare in Grand Forks.
So do you provide services just to people in Grand Forks, or do you service all of North Dakota?
Well, we do Grand Forks initially, but we just branched off to Bismarck this past year, and we opened a clinic on State Street.
Yeah. Okay, so can you just give me a little bit of some of those examples of the alternatives that you guys specify?
Sure. So for instance, people come to us when they've tried some pharmaceuticals and they're having bad side effects. They're looking for herbal therapy, they're looking for acupuncture, chiropractic, they're looking for naturopathic doctors. I know in Grand Forks particularly, we only had 2 in the area and they just recently started there, so people weren't aware that they existed. And we have a working, conversation with those doctors as well as far as referrals.
So how have patients responded to things such as the medical marijuana?
You know, patients themselves are very interested and open to it. We get patients from all walks of life and all ages, and they come in and they try it. We've just gotten to the renewal territory where we're seeing them after they've been using it for a while, and the results are phenomenal. We have grandparents saying that they're going to their child's basketball game and sitting in the bleachers for the first time in 2 years because their pain's finally under control. Same thing with women who have horrible endometriosis. They're able to treat that pain and go about their lives, take care of their kids. People are able to get certain combinations of medical marijuana that allow them to even use it at work and not be high. So we're just getting a lot of different positive feedback that's made us very happy to be offering this service.
So I guess to go along with that, you say to not be high. So have you guys got any, bad comments or anything related to this? Can you tell me a little bit about that? Not
so much in our patients, but when we first started in the community, I think that it was still very closed-minded about the medical marijuana program. A lot of businesses weren't really open to discussing it with us, but now that we've been in business for about a year now, we're having a lot of providers actually refer their patients to us to talk about it when they are hands up, can't do anything else for them. Also, a lot of psychiatric providers are seeing their patients benefit from it immensely and have been sending their patients to us.
So are you guys also, discounting other pharmaceutical drugs, or are you just providing this alternative?
I think that there is a place for pharmaceuticals, and if they're working for the patients, we discuss whether those pharmaceuticals are going to have side effects with medical marijuana. But a lot of people do want to get off of them, and they come to us and we talk about a weaning process, and we also talk about even other therapies they can use, for their pain, such as acupuncture, chiropractic, physical therapy, that kind of thing.
Yeah, a lot of the calls that I take are actually patients that seem really upset that their doctors keep trying to put them back on opioids. That's kind of the biggest thing that I feel like I've heard from patients that are really upset with their current doctors. They'll even say, my doctor knows that I've been addicted to these, and they don't really seem to have any other alternative for their patients. So it's really nice that we can offer these patients an alternative to opioids, for example.
And even for patients who are non-operable, we have people who say, hey, I've tried injections, I've tried opioids, I don't want to be on them, my condition is inoperable. So this gives them something they can control their pain with.
As well as like neuropathy, PTSD, I've heard the same thing, pharmaceuticals add bad adverse side effects, and they're just fed up with it. And now that we're in recertification territory, we've heard, really good things from our patients, and that it cures or takes care of their symptoms without the adverse side effects. So it's been really positive so far.
So I guess in few words from you both, what do you want viewers to take away from this?
We want them to know that now in Bismarck they're going to have an alternative option since we started our business branch out here, and that if they feel like they could benefit from medical marijuana, to give us a call and we can discuss whether they qualify or whether they would in fact benefit from it.